Strap in, folks. This is going to be a long one. So, there's this old joke about a new doctor starting his first day as a resident physician at a mental institution. During the safety lecture, the facility director tells the new guy to keep an eye on the paranoids in case of a structure fire. Why the paranoids? The young doctor asks. Because, the director says, they've already plotted every way out. So here's the thing. Mental illness is, for real, no joke. Unfortunately, much like obesity, it's one of the few human conditions that is still an acceptable target for base humor. That girl cray-cray, you don't have to be nuts to work here, but it helps. Oh no, Dave is about to go postal. Popular media is filled with depictions of mental illness that is either played for laughs, i.e. Rebecca Bunch from Crazy Ex-Girlfriend, or derision, like the real people on A&E's long-running show Hoarders. The audience is then encouraged to laugh at the crazy person or to feel some sort of pity out of a sense of superiority to the loony on screen. Mental illness is on the rise. A recent study by the World Health Organization reports that globally, an estimated 264 million people are affected by depression. Bipolar disorder affects about 45 million people worldwide. Schizophrenia affects over 20 million people, and approximately 50 million people have dementia. That's just among the adult population. Depression is one of the leading causes of illness and disability among adolescents ages 10 to 19 years old. And suicide is the third leading cause in 15 to 19-year-olds globally. These statistics cover the normal ebb and flow of the myriad of mental illnesses that are tracked. These numbers don't include the marked increase in reports of depression, anxiety, suicidal ideation, or even emerging symptoms that present as PTSD due to the global pandemic. People at risk for mental health conditions are really struggling. From April to September 2020, among people who screened with moderate to severe symptoms of anxiety or depression, 70% reported that one of the top 3 things contributing to their mental health concerns was loneliness or isolation. The global pandemic has contributed to the disruption of work and school routines, normal social activities, and just normal life. It's far too soon to even begin to speculate what the long-term effects of this will be on mental health worldwide. Adolescents are already at high risk for depression, anxiety, and suicidal ideation. The added disruption and stress of online learning, no social interactions, and the irrevocable loss of milestone life events like prom and graduation will haunt this generation of young people for years to come. And then there's the upcoming election. According to a Pew Research Center survey of more than 12,000 U.S. adults, about 2/3 of Americans feel worn out by the amount of news there is. It's exhausting. The relentless din of awful is wearing even the strongest people down. And don't get me started on Trump fatigue, which of us hasn't gone to bed stressed to the teeth after the endless stream of ridiculous stunts every hour of every day? You cringe when passing a TV or newspaper, horrified to look. Every social media alert on your phone creates tension and apprehension. What do you do now? What is he going to do next? John Mulaney's analogy about Trump being like a horse in a hospital is far too kind at this point. It's more like watching a cobra slither out of a baby's crib. You know there's no good ending there. The damage has already been done. But Xander, I hear you saying, why can't you just be a man instead of a big crybaby snowflake sissy boy? Why don't you just pull up your big girl panties and cowboy up? Why can't you just... Well, you fill in the blanks, because I know you've been on the receiving end of the same conversation. We all have. And that's the problem. Mental health issues are not just a matter of suck it up or take a lap or walk it off. Depressive disorders, anxiety disorders, bipolar disorders, schizophrenia, autism spectrum disorder, obsessive compulsive disorder, social anxiety disorder, substance abuse disorders, eating disorders, mood disorders, personality disorders are all real diseases or conditions. They're all serious health concerns that require professional medical treatment. Mental illnesses are often lifetime conditions. There is no magic pill, no quick fix, no simple remedy. Mental illness is like a forever friend, a difficult and destructive forever friend. Unfortunately, The stigma attached to mental issues makes it difficult for some people to seek help. They are embarrassed and humiliated by a condition that society at large labels as weakness or a moral failing. Even if they can muster the courage to ask for help, access to care is frequently out of reach for most. This problem is made more real for our nation's veterans. The U.S. Department of Housing and Urban Development estimates that on any given night, over 40,000 veterans are homeless. According to a 2016 U.S. Department of Veterans Affairs report, current analysis indicates that an average of 20 veterans die from suicide per day. A 2016 study published in the American Journal of Public Health shows that over 1.1 million Americans who were treated in a VA patient-aligned care team were diagnosed with at least one of 5 mental illnesses: depression, PTSD, substance abuse disorder, anxiety, and schizophrenia or bipolar disorder. The VA has consistently been under threat of massive budget cuts that would further reduce this access to health care for veterans with mental health conditions. Before President Obama's Affordable Care Act passed in 2010, there were more than 48 million uninsured people in the United States. Because of the nature of their conditions, people with mental health illnesses are more likely to have low incomes and to be uninsured. In 1996, some progress was made with pre-ACA with the Mental Health Parity Act, which required all large group employer insurance plans to cover mental health services at the same level as other services, if they offered them. This created parity laws, which means that there cannot be greater cost sharing or other limitations specifically for mental health services. However, those parity laws did not apply to individual and small group plans. Depending on the type of plan, insurers in those two markets could screen patients for mental health history and use that information to deny coverage, exclude and cap mental health services, increase premiums and cost sharing, and restrict access to helpful drugs. The ACA made some strides by pairing coverage expansions with access to mental health care. Efforts to expand coverage, including allowing young people to stay on their parents' plans until age 26 and expanding the Medicaid program, led to a drop in the number of uninsured people to 30.4 million by 2018. Unfortunately, the Republican Congress and the Trump administration has been fighting tooth and nail to repeal the ACA, going as far as the Supreme Court on multiple occasions, with no equitable replacement in sight. Once again, millions requiring care will be booted out of a system that was making small strides in addressing mental health services. However, even with government-run insurance like Medicaid or VA healthcare for our nation's veterans, or affordable private insurance, many vital services are still out of reach for the average person. High copays for psychiatric care or medications for various mental conditions leave most people choosing between food, shelter, or utilities and their anxiety medication or therapy. With rising tensions due to pandemic fatigue, election fatigue, and most of all, Trump fatigue, many people they've opted for a more traditional form of self-medication. Nielsen reports alcohol sales in stores were up 54% in late March, compared to that time last year, while online sales were up nearly 500% in late April. According to a Morning Consult poll of 2,200 U.S. adults conducted in early April, 16% of all adults said they were drinking more during the pandemic, and with higher rates among younger adults. 1 in 4 millennials and nearly 1 in 5 Gen Xers said that they had upped their alcohol intake. Alright, I know that was a lot. Stressful even. Like, I'm stressed, you're stressed, the director is stressed, the head writer is freaking out over there. And even people without diagnosed mental health conditions are struggling. And the situation has become dire for those only barely holding on in the first place. So, where does this leave us? What can we do? I don't feel like there is a simple answer, but the Anxiety and Depression Association of America offers these helpful tips to manage anxiety, stress, and depression. Take a time out, eat well-balanced meals, try to limit alcohol and caffeine intake, get enough sleep, exercise daily to help you feel good and maintain your physical health while improving your mental health. Take deep, calming, cleansing breaths. When stressed, count to 10, slowly, repeat, and count to 20 if necessary. Do your best. Instead of aiming for perfection, which isn't possible, and be proud of however close you can get. Accept that you cannot control everything. Welcome humor. A good laugh goes a long way. Like, there's a reason why they say that laughter is the best medicine. Well, after actual medicine. Do your best to maintain a positive attitude. Make an effort to replace all the negative thoughts with positive ones. Less why and more pie. Learn what triggers your episodes. Is it work, family, school, or something else you can identify? And finally, most important of all, talk to someone. If you don't have someone in your life that you can talk to, there are many fine organizations that you can reach out to for help. Contact the National Suicide Prevention Lifeline, which is a U.S.-based suicide prevention network of over 160 crisis centers that provides 24/7 service via a toll-free hotline at 1-800-273-8255. It's available to anyone in suicidal crisis or emotional distress. Or are you a veteran in crisis or concerned about one? Connect with the Veterans Crisis Line to reach caring, qualified responders with the Department of Veterans Affairs. Many of them are actually veterans themselves. The Veterans Crisis Line serves all veterans, all service members, National Guard and Reserve members, military family members, and friends. It is confidential and available every day, 24/7. Call 1-800-273-8255 and press 1, or text 838-255. The Trevor Project is an American nonprofit organization founded in 1998, focused on suicide prevention efforts among lesbian, gay, bisexual, transgender, queer, and questioning youth. Through a toll-free telephone number, it operates the Trevor Lifeline. It's a confidential service that offers trained counselors 24/7. Call the Trevor Lifeline at 1-866-488-7386 or text START to 678-678. The crisis text line extends to everyone. Their goal is helping people move from a hot moment to a cool moment, guiding you to create a plan to stay safe and healthy. 24/7 help is available. Just text HOME to 741-741 from anywhere in the U.S. anytime. So please, if you need help, ask for it. There's no shame in admitting that you need someone to get you through a tough moment. There are trained, understanding professionals waiting to hear you. Talk to your friends. Talk to your family. No matter how dark the world seems at the moment, and I'll be damned if it's not been clouding up for some time, there is light at the end of the proverbial tunnel. To quote musical genius and venerated 20th century philosopher William Martin Joel, "You may be right, I may be crazy, but it just may be a lunatic you're looking for." Remember kids, you can't spell Xanax without Xan. We'll be right back.